You know, doctor, when people get diagnosed with cancer, it's panic, and they're told you have to do something right now in order to take care of that. What do you recommend are some of the first couple steps that a person should take? And I know cancers are different, so just on a generic term, what are some of the first couple things that someone should do once they get that diagnosis?
I think you have the right to panic. You have the right to panic, to cry, to scream, to everything. Do it for a little while, okay? Do it for a couple of hours and do whatever you want, but then sit down and start a little bit of reflection. What do you want to do? What can you really do for your body? And one of the first things that you can do, you can begin doing that very same moment, is doing lifestyle changes. Learn about it, read about it, talk to other people about it, make dietary changes. Stop intoxicating yourself. If you smoke, stop it. If you drink alcohol, stop it. Start doing things that are going to be helping. Treat yourself as you would be treating your sick dog or your sick plant at home. If you have a plant or a pet that are not looking good, the first thing you're going to do is you're going to look for their comfort. You're going to try to feed them better things. You're going to try to give better water. If it's a plant, you're going to look for a little bit of sunlight or whatever. That's the first thing you have to do. You have to start looking at yourself as what you are, a living thing. And you have to start giving yourself a lot of consideration, rest and so forth. And start reading. Right now with the internet, you can have tons of information in a couple of hours. So learn about it. And something that I always tell patients, talk it over with the people you trust. Don't keep it to yourself. Many people do that. That's very bad. That raises stress tremendously because they try to hide it. And why don't you eat? Well, it's I'm not feeling good and so forth. No, scream, say, because I have cancer. I don't feel well. And I don't think anybody who's been told you have cancer feels like going out for dinner. So the mere fact that they're telling you that, that's ruining your appetite. So whatever little appetite you have, use it to your advantage. Get good foods, foods that are going to nourish you. Raw diets are not good for everybody. They might not be good for you. But there are things that are very good for everybody, like fish. So start learning about it and then say, okay, this is what I want to do. And then learn your options. What can I do? Many times patients call me and tell me, you know what, my husband insists that I do what the oncologist is telling me. And I talked to the husband and I said, look, okay, let's do that. But let's give this body the chance to build up. Because this lady was told she has cancer, then she was operated on, she's hardly recovering, and now you're going to give her chemo. Is she going to do well? Or is she going to do bad? She's going to do bad. She's going through weeks, if not months, of suffering, bad diet, poor nutrition. She's probably very low, biologically speaking, and now you're going to give her chemo? No, give her body the chance to recover. Let's do something really proactive. Let's go intravenously. Let's build her up. Let's do hyperthermia. Let's weaken that cancer. And then you go with your oncologist and you're going to be surprised. He's going to be surprised on how much better she did, how much better she tolerated the treatments. So it's important for people, and even if you don't have cancer, you have to learn about it. You have to start thinking about it. Okay, I always tell people that cancer prevention is like Japanese always say, when is the best time to plant a tree? 20 years ago. Okay. So it's the same with cancer prevention. When is the best time to start? From the time you're born. You have to start eating better, drinking good water, exercising, looking after yourself, get that horrible cod liver oil, get foods that are going to nourish you, not just fatten you. And with all those things, you're going to be creating a much better body. But this is even more important when you have cancer. You see? And then you see the options that you have. That's very important. Go to the websites, review them, call we have an 800 number. People can call us. It costs them nothing. We have, and this is something I'm very proud of, we have our doctor at biocarehospital.com, and I always encourage people, I mean anybody, you have a question, drop it. I mean, get it out of your chest. Just type it. It's going to cost you nothing. You don't want to tell me who you are, I don't care. But you can say, look, I have stomach cancer, was diagnosed in, I'm thinking of doing this, doing that, what do you think? And I'll give you an honest opinion with the information that I have of what I would do if I were you. And we do that all the time. We have lots of people that send us questions. And I, like, for example, at the conference yesterday, I always tell people, not only use the mail, but share it with anybody. You might be talking to a person in the supermarket that tells you, I have cancer. Say, okay, drop a question to these guys and see what they tell you. Because information is what we need. We need to, and that's what I would urge. Any patient that's being told they have cancer, do your homework. Because unfortunately, in 2011, doctors don't know best. You have to become a very important partner in your health care if you really want to be successful.